Hi there. Today I'm going to talk about fibromyalgia. My name is Dr. Anthony Talorico. I've been treating patients with fibromyalgia for about 20 years, so seeing lots of things with fibromyalgia, and I just want to kind of go over some of the things that people mostly know if they have the condition, but then I also want to talk about a couple of other things that I find to be very important in them to get well. And so that's the number one thing we want to try to do, is get people well so they don't stay in this situation for years and years and years of time. If we look at what is called fibromyalgia, it's basically a pain syndrome that's marked by things like muscle, tendon, ligament pain. It's supposed to be, under the classifications by the Academy of Rheumatology, it's supposed to be 11 of 18 tender points that are above and below the waist and on both sides of the body. So if you have all these tender points and you don't know why you are tender, the classification typically comes down the road that you have fibromyalgia, which basically just means muscle, tendon, ligament pain. That's what that means. The classification also includes that the person may have a sleep disturbance, and by that means that they don't have restorative sleep, that they're not getting good rest even when they're quote-unquote sleeping. So that oftentimes people are prescribed medications for pain and to sleep. Also, patients also have depression, and they're oftentimes given medication such as SSRI, which is selective serotonin reuptake inhibitors, and that's to keep the serotonin level higher and to help them feel better emotionally, but also supposed to help with pain. In my experience in treating patients with fibromyalgia, there's a couple of things you first have to eliminate as topics, and the number one being a thyroid disorder. And so the big one on this is a category in and of itself, but the majority of patients who have fibromyalgia are women. The majority of people who have thyroid disorders are also women. So these two things go hand in hand. This would be the single most important thing if someone comes in with a new fibromyalgia diagnosis. This would be the single most important thing to really look at, really drill down on this and find out, okay, they have fibromyalgia, at least the diagnosis, but do they have a thyroid problem? Because fixing this sometimes completely eliminates that. The number two thing we look at is, do they have anemia? Because the symptoms of anemia can overlap into some of the things with fibromyalgia. You get a lot of fatigue, lethargy, you can get soreness, you can get pain, you can get a lot of these other things. So we want to rule this out as well. Number three thing is diabetes. And this could be active, already diagnosed, or it could just be the pre-diabetic state, and it could be just insulin resistance, but it's marked by a low energy level, so people oftentimes will have these things. And then the last thing, and this is odd, this is called Chiari Malformation. And Chiari Malformation is basically a congenital problem with the spinal cord and the opening in the brain, skull, the way that the cord and what's called the cerebellar tonsils come down through. So sometimes they have a really narrow opening and they have a tightening there, or sometimes the opening is too wide and the brain and cerebellar tonsils are actually sliding down into the spinal column where they shouldn't be. And the result is an electrical issue. There's pressure on these nerve structures. This can also kind of throw in here, this could also be spinal cord pressure. And this could be from something like arthritis or cervical spine stenosis or narrowing of the cervical cord. And so these things here, these physical things, can manifest in a lot of these other symptoms. So the big part is, part one of this is, okay, so we've been diagnosed with fibromyalgia. Let's drill down and find out, is that the case? And if that is 100% the case, let's go from there. If it's not the case, and we have to look at these other things to see if we can help. And oftentimes we can. So we can help with thyroid, we can help with anemia, we can help with this. This is more difficult. Some of these patients, you know, there's nothing you can do for them. Some of them actually result in brain surgery. But the thing is about this is, these symptoms of this condition, they look a lot like that condition. And so people are under the diagnosis of fibromyalgia, but they have what's called Arnold-Chiari Malformation, or they have cervical spine stenosis. Now, to a lesser degree, what I find is my patients who have this have a much milder form of spinal cord pressure, and that's in areas of the spine, especially the C1, C2, which is at the base of the skull, and at the mid-neck at C5. So C5 is like the apex of the curve. So if the neck is, we're looking at a person from the side, they have a curve that's supposed to be like that. C5 is at the apex. And a lot of my fibromyalgia patients have problems here or up here. In terms of structure, they have pressure on those nerves, and that nerve pressure is giving them symptoms that are not quite as dramatic as Chiari Malformation, but they affect the electrical system of the body, and they get low energy, they get a lot of fatigue, they may have sleep problems. A couple of things that we'll go into on the part 2 of this video is, okay, we've got this, and now what can we do about it? So part 2 is going to be, what steps can we take to start to rein it in and get a person to get some results.